Well, thank you so much, both of you, Kate and Rochelle, for just two really electrifying presentations. And it's a good thing that Neil didn't show up, because I don't think there would have been time for him. So we're going to extend our time until 4:30. So we do have about 10 minutes for questions, both here in the audience and from the web. So if you have questions or comments, I'm sorry, Rochelle had to go away to catch her flight. Hopefully she's going to make her flight. Yes?
So I love the idea of pairing a narrative with PSA. And I was wondering about the proactive process of maybe presenting like an issue or something that you feel is important from the public health perspective. And does that process ever happen? How does that work? I've heard of that with the CDC and some things about coming out and saying these are the storylines we think that people need to hear. But can you tell us a little bit about how that goes and how you maybe push them to say, well, it'd be really great if you had a PSA at the end too, with these websites and phone numbers. I just looked at that.
Sure. Well, first I should say that we're Hollywood Health and Society. We're not an advocacy group. We are a nonprofit, but the only thing we really advocate for is the science, the data, the truth, and we're not master storytellers. Those guys work in Hollywood and are making a lot more money than I am. So that's why, because they're master storytellers. So we don't ever pitch a storyline, and we don't ever propose to be the expert. So we're kind of the matchmakers. We're kind of the interpreters in that, we help the, pardon my expression, the wonky scientists be able to talk to the Hollywood storytellers so that we can get this information out there. So we don't specifically go and pitch, but that said, we've been working in the entertainment industry since 2001. We have partnerships, as I said, with the Writers Guilds, with the Television Academy, a number of other organizations, and Hollywood knows us. And they know us and they trust us, and they know that they can come to us with their questions, and we're not going to push an agenda on them. So we take that very seriously. The only thing we'll push on them is that this is the fact. No, you can't say this. That's not true, and you don't want to put that out to the general public, but you can say this. So we don't specifically push a storyline. However, we are very happy to be able, because we have such a good relationship with the entertainment industry, that we can call them up and say, hey, I've got this great researcher that's in town who's doing this fantastic study on XYZ, and there's all kinds of new information, and they've got great case studies to tell you about. How about I bring them into your room, to your writer's room, and they can tell you about their work? So we often do that, and our sort of motto is to inform and inspire the entertainment industry and television and screenwriters to look at these topics and be inspired by them. And one way we do that also is we provide them with a lot of case studies about real people, real stories about real people and the challenges they're facing with regard to their health. And writers love to read about real people. They're writing about fictional people that are usually based on real people. And so we do that, and we give them a quarterly newsletter we send out to over 900 entertainment industry professionals that we used to say we would maybe title it Steal This Story, but we thought that was a little too on the nose. So we just call it Real, R-E-A-L, to Real, R-E-E-L. And it's just stories that we've culled from the news and elsewhere about real people and the challenges they're facing on a number of health topics. The CDC usually has a number of priority topics that they're interested in. That doesn't completely designate what we focus on, but we obviously want to add some attention to that if that's something that's, that they're seeing as a real need in the country. So, so we provide them with as much sort of fodder for them to take home and digest and then put it into the fabulous stories that they tell. And again, they can do a much better job at spinning a story than I ever could. So does that answer your question?
Yeah, it's just kind of putting everything in the right place so that the magic can happen.
Right. We just say, look at our plentiful array of, ingredients. Now go and cook something up, that kind of a thing. So, yeah.
Great. So just to note, we have a question from Martha. We also have Rochelle joining us via conference call as well shortly. So if you have questions for her also, please.
So I'm on the line now. Thank you very much, Kate and Rochelle. I don't know that Rochelle's on it. Kate, I think it's a sort of a follow-up on what you were just discussing. I think one of the challenges that we're having here, as you've probably learned being here with us today, is how we're framing things that are really determinants of health that are beyond individual behaviors. And, we're trying to think about how we can locate those stories within entertainment. Public health messages are great, and we can think about little narratives and little stories, but I think, as everybody knows, you see a powerful movie, you see Silkwood, you see a civil action, you see Philadelphia, and you have individuals and then you have large societal issues. And those are the things that I think when they hit people at particular times are so resonant and transforming to some extent of how the public thinks. And we want to infiltrate. And the question to you is, how would you advise us to do that? You need to be, independent, and you need to not advocate, but maybe we want to advocate. And so how would you suggest to us that we approach the larger entertainment industry to insert messages?
Sure. Well, I've been doing this work, this type of work, since before it had a name. Now they call it entertainment education, but I was doing it before it was a thing that you could actually go and get a degree in now, and I started out in the advocacy world, working in addiction, reaching writers on issues of alcohol and other drug addiction and recovery issues. Then when AIDS came to town in the early 90s, late 80s, early 90s, I went to work to help inform the entertainment industry on the realities of HIV/AIDS and help dispel a lot of the myths and crazy ideas that were out there and hysteria. And so luckily the entertainment industry, which was hit very hard by AIDS, embraced that mission and really took it upon themselves to, we worked with them to create the first HIV positive character, and he could kiss his girlfriend and she didn't get it, and a lot of role modeling in that way to help sort of dispel some of those myths. And so, and then I've moved on into, as I alluded to earlier, I worked with Neil on Cover the Uninsured and a number of other issues, and I'm now at Hollywood Health and Society. And I can tell you that I was around when Hollywood Health and Society was first developed, and part of the reason Hollywood Health and Society has become so successful is that we're not advocacy. Because what happened in those days was there were like 150 or 200 some advocacy groups in Hollywood that were all trying to reach the same television writers. The Alzheimer's people and the AIDS people and the reproductive health people and the diabetes people, and they're all, and it became such an issue for the writers that they stopped taking calls from anybody, and they just shut down. And so what happened, I was in on these early discussions about how do we create an aggregate, a one-stop shop where writers can get the information they need without feeling like they're being lobbied or pressured in one direction or another. And that's kind of how Hollywood Health and Society was born. And we're very proud that, again, we're advocating for the truth and the data, and we, of course, like I said, we bring up interesting studies or new developments and give that to them without doing any finger pointing or any blame. And some of you probably noticed some disparities and some maybe irregularities in some of the clips I showed, and that's sometimes the price we have to pay to get the bigger message out there, is not to finger point them when they maybe do or say something that's not quite as accurate. But we're reaching the general public on the fact that there's now a gene that you can be tested for to find out if you're, if you've got the predisposition for breast cancer, where that wasn't, that was not available before. So things like that, even though. So anyway, that's a long story. To get back to your question, which is, first of all, call us. And give us your most up-to-date information, and we'll keep it and have it available. And second of all, I would encourage you, if you want to reach out to the industry on your own, to be positive and not to be finger-pointing, because there's lots of advocacy groups out there that like to blame and protest and tell them what they're doing wrong. And as we know, you can attract a lot more flies with honey than you can with vinegar. So I would encourage you to just, be supportive and encourage them in their work and provide them with the great information that you have to offer. Does that help?
So I think we're unfortunately out of time for questions. I just want to leave you with the summary points from this very interesting and informative session. I have several. So the first is that combination multi-pronged strategies, so a PSA plus a storyline or a documentary, education campaign and website, a multiply impact of messages. The powerful stories have a high impact that it makes getting it right all the more imperative, which is, I think, where Hollywood Health and Society really comes in. And as Rachel pointed out, putting the I in population health stories can really strengthen the impact of narratives that seek to raise awareness of social determinants, which is what we're concerned with. We can also track multiple outcomes, and in fact, just tracking a singular outcome would miss what kind of impact we're actually looking for. And that TV and film and attendance strategies can really help shift language and provide a common language for understanding of public health messages. And the production of communication and stories related to population health can be active, engaged, and shared. And in order to coordinate efforts to shift our understanding of population health, we have to have our houses in order and be strategic in how we approach a coordinated effort. And connecting audiences is key, and what we want is action, not just reaction. And finally, our success in achieving dissemination of information and ultimately affect behavior change can depend on selectively engaging in advocacy. So thank you very much for a great panel, Kate and Rachel.
Thank you all so much. Bye-bye.